our special guest for this week. She is a cancer patient advocate and a chronic pain advocate. She brings a wealth of knowledge and a fantastic personal story to this topic. Cara, are you with us? Can you hear me?
I can hear you.
All right, fantastic. So Cara, tell us a little bit about your story, how you came into the space, your experience with cancer. Introduce yourselves to us.
Sure. Okay. So yes, I am a city councilor in my area, and I also have stage 4 cancer, colon cancer. So make sure to get your colonoscopies. Don't be like me. And I realized once I was undergoing treatment, starting to hear stories from other cancer survivors, that they were having more difficulty getting their pain treated. And at the same time, we were hearing about, of course, the opioid crisis. But we got constant reassurance, both individually and also in our various support groups and our different organizations that advocate for us, that this, whatever came down would never affect cancer patients. It would never affect cancer patients. Cancer patients, of course, would be exempt from any regulations, any laws, everything governing pain management. And we realized almost immediately that was a complete lie, and it is a complete lie. So we started to see that it was taking more and more effect within the cancer community, that people couldn't get their pain treated at all. They're being taken off pain medications. And I started to get very involved at that point. And I started finding out that this, wasn't just affecting the cancer community, it was affecting the chronic pain community, people with rare diseases, people with degenerative diseases. It was happening across the board. And so I started to speak out against it. I started to advocate at my state legislature. I started to get contacted by residents within my city asking me if there was anything I could do. The more I spoke out about it, the more I was contacted by people across the state. And at this point, it is overwhelming, the number of people who are contacting me, telling me their stories, and they are horrific stories of what people are enduring, and they can't get proper treatment. I'm being contacted by doctors. I'm being contacted by nursing staff in palliative care, hospice. The stories of what's happening is horrific. This is an actual humanitarian crisis that's going on not just in my state, but across the country right now. And it's one of the reasons why Human Rights Watch has opened a file on the United States specifically on this issue under the heading of medical torture. So
is this an issue so you said it's happening nationwide, it's not just in Minnesota where you're from.
Exactly.
Is it a matter of state legislators in every state have taken on some kind of model? Is that what we're seeing?
Yeah, they do copy each other. What happened was in 2016, the CDC put out guidelines. And these were guidelines for primary care doctors, just to give them general guidelines on how you should prescribe pain medications. And it was voluntary, and again, it was just supposed to be just narrowly defined within primary care doctors, because primary care doctors were asking for more guidance on this. Doctors already knew that there was some overprescribing that had been going on, but it had corrected already by that point. We were down about 30% of prescriptions for pain medication, but they still wanted some guidelines. When's a good time to do it, when's not. These guidelines came down, and when they came down, everyone took them as if it was a law. Not a voluntary guideline, but a law. State legislatures put those guidelines, which were just to limit in very specific cases when you might prescribe it. And they did it carte blanche. And so they put these hard limits down saying you can only prescribe 3 days worth, or you can only do this, or you can only do that, or you can only prescribe to this group of patients, but not that group of patients. At the same time that was going on, Congress did a law U.S. Congress, and President signed it into being. President Trump did. And a couple things happened. Number one, it really restricted Medicaid and Medicare on what they could prescribe for pain medication for people. The VA almost wiped out their pain management that they do. And then the other thing that it did was told pharmacists not only that they could deny a pain prescription for any reason whatsoever, they don't have to even articulate a reason, but that if they don't and something's going on with it, they could be held liable. So all of these things started to go on, and then the DEA got involved in it. And the DEA looked at these guidelines and said, any doctor who's prescribing outside of these guidelines, we can investigate them. And they started to investigate them, and they started to go after them, and they would perp walk them out of their clinic. Didn't matter if they had a high number of patients who were in palliative care or were cancer patients, or even if they were a pain management doctor and that was their specialty. Step outside of those guidelines and they've really been going after you. State legislatures, 33 of them, actually 34 now, unfortunately, have enshrined into state law these types of prescribing guidelines. They've also funded extra law enforcement to go after doctors. And so this has resulted in patients being dumped off from their doctors because the doctors are scared. So doctors are refusing to prescribe or treat pain. They don't want to lose their practice. They don't want to go to jail. They don't want to be subject to civil asset forfeiture. So patients are not having their pain treated. And patients are being dumped by their doctors. When doctors come under investigation, all of those patients have to find another doctor. Well, what doctor wants to take the patients that got that doctor investigated? None. So we have cancer patients, we have pain patients who can't even get a doctor to treat them for anything because they've been dumped by their previous doctor and no one wants to touch them. And so now CDC, the American Medical Association, and the FDA have all hit the panic button.
And just to
because
summarize,
what they've seen, because they have seen the horrific after effects of what's happening now. We have a rise in suicides, a shocking rise in suicides. We have a rise in disability claims because that's the number one reason people go on disability is untreated pain. We have a rise in social services being engaged for people. We have a rise in emergency calls because of untreated pain. They can't get it treated through the regular doctor, so they're using emergency services. It is horrific what's happening, and seeing what's happening in my states. This is happening to people I know. There's a gentleman I know, and he's in his 70s, and he has stage 4 colon cancer. It's terminal. He's trying to hang in there. He was removed from his pain medication. So at age 70, he went out and bought heroin because that's all he can do. That's all he can do to cope. He told me he's never even smoked a cigarette. The shame in his voice when he was telling me that's what he was driven to. We had a young mother in Mankato, Minnesota, and she was in a car accident. Drunk driver hit her. She had pain because her injuries were extensive. With pain medication, she was able to hold a job, care for her children. She was not addicted. There was not a problem. But her doctor became very worried and concerned that he'd be investigated. So he took her off her pain medication. She went and bought heroin. Unfortunately, it was laced with fentanyl, and she died. We have cancer patients, 2 of whom I know exited palliative care, which means you're in treatment for your cancer, but they're managing your pain and your symptoms. They had to exit because they would no longer give them their pain medication, and it was excruciating. It's in their bones. And so they entered hospice care, which is basically you have to give up. You can't be treated anymore for your cancer. It's a slow suicide is what it is.
And just for the audience, hospice meaning they can be treated for pain, but not for the actual disease that they have.
Yes, it is to ease you out of your life.
And let me just back up, because you did share a lot just there.
Mm-hmm.
The CDC, the Center for Disease Control, released guidelines for primary care physicians, so general practitioners. Basically a technical footnote, if you would, for for medical professionals. And this later became laws created in state legislators and at the federal level. And they were turned into civil and criminal offenses.
Absolutely, yes.
Got it.
Yes.
And doctors are essentially being treated, if they go outside of these guidelines, as if they were a common drug dealer, thug, like that.
Yes, they absolutely are. And they have to prove their innocence, because they can have their license removed without a criminal trial. So they have to prove their innocence, which could take 6 months to 2 years. Well, they don't want to risk everything they've worked for their entire life. They're not going to do it. And doctor after doctor that's contacted me has used those words. I can't risk it. I'm scared. I can't do it. I can't risk it. And that's sad that we have, we have government doing this to our doctors and to our patients and our cancer patients and our veterans and, everyone that needs help. And the sad thing is, this is all based on a lie. The lie is that people who are prescribed pain medication turn into addicts. And we know it's a lie because there's been studies done year after year after year that if they screen patients to make sure they don't have a prior addiction, there is a 1% addiction rate. So all of this is happening because of a 1% addiction rate. And it's because of false narrative that's being pushed. And it's sad.
So to be devil's advocate, we've seen that fatal ODs have risen 250% since 2007.
Yes.
So you're saying that has nothing to do with the doctors?
No, it's illegal drugs. The overdoses are on illegal drugs. The interesting thing is, the more they clamp down on prescription pain medications, which again, doctors have already corrected for this. Pain medication prescriptions are down 30%. They're down 30%. And yet, the OD rate is skyrocketing because it has nothing to do with patients and doctors and prescribed pain medication.
Right.
It has nothing to do with that at all. And these things are based on a lie. They put information out there to scare people because, they want this to be the new drug war. It's an easy drug war. Doctors are sitting targets and so are patients. And most pain patients and cancer patients are so ill they can't fight back. They can't advocate for themselves. They're very easy targets. And you'll hear things like more people, you're more likely to die from a prescription opioid addiction than a car accident. But when you break down those numbers, what it is yes, 60,000 people die from overdoses. But that includes everything, including aspirin and anticoagulants and every kind of drug. If you limit it to just opioids, legal and illegal, you get down to about $30,000 or 30,000 people. But if you get down to just prescription, and this is even if they're diverted, like they're taking someone else's prescription, just prescription opioids, that's down to 5,000 a year. Still 5,000 people, but that's 5,000 a year. To give you an idea, car accidents are 40,000. 6,000 people a year die riding their bike.
So there's been a manipulation of the statistics really for an agenda. Well,
there's a very strong agenda on this.
We've got about 3 minutes left, Cara, and I want to just cover where is the legislation at right now and what else needs to be done for activists and advocates like you. What work is there left for you to do, and what should we be paying attention to?
Right. Okay. What people need to do is, if your state has not already passed opioid legislation, you need to do everything you can to block it. If your state has passed it, like 34 of them have, you need to oppose it. At the federal level, we're doing well on pushing back against that. The CDC has revised its guidelines. It's sent out notices. The AMA is doing that. Federal is actually doing pretty well. It's the states that are doing the most evil work. The DEA is the DEA, and they're going to keep prosecuting for as long as these state laws are on the books. So get involved. But what people can do is push back against these lies anytime you hear them. Anytime you hear anything about, this opioid epidemic, push back on that. It is not a prescription pain medication epidemic. That's not the problem. So push back against it. And it's there because people are making money on it. One of the main proponents of this, that is pushing this narrative the most, is a man named Dr. Clodney, and he is with an organization called PROP. He stands to make millions off of this, and he has all along. When he was a New York City public health official, he went to hospitals, went to doctors. There was a $10,000 bonus if they did his drug that he was pushing forward, which was buprenorphine and Suboxone, to do that. And now he's gained notoriety, and he's the opioid expert. He's the one that's testifying in Oklahoma in all of these lawsuits. He's getting over $500,000 just for this lawsuit. There are 2,000 lawsuits filed. He's going to cash in on almost every one of them.
Well, we're out of time. What we're going to do, Cara, is we're going to mention these stories in the show notes for our audience. So we'll get together on the back end, and we'll put those in the show notes. And for now, that's all we've got. Cara, thank you so much for being on. We're going to direct everyone to make sure they've got a way to get a hold of you and how to find out more about you and what you've done. And again, thanks so much for being on.
Absolutely. Thank you.